You take vitamin D every day, but you still feel tired. Your bones ache, your mood's all over the place. You've done everything right. Well, at least that's what you thought. But the truth is, most people are taking vitamin D completely wrong. And if you don't fix these mistakes, you're kind of wasting your money on these supplements. Or worse, you're causing harm without even realizing it. Stay to the end because the most important step is the one no one's talking about. And I'll mention it in this video. Assalamu alaikum, my name is Dr. Azad. I'm a medical doctor and a pharmacist based here in the UK. Vitamin D is not just a nice to have supplement. It's essential for bone health, it's essential for immunity, for your mood and hormone balance. In the UK, we simply don't get enough sunlight, especially from October to March, and almost 1 in 6 adults has low vitamin D without even knowing it. And that's why so many people still feel off, especially during those winter months. So let me show you how to take vitamin D the right way. Let's start with number 1. Take it with fat. Vitamin D is fat soluble, and that just simply means if you swallow it on an empty stomach or with dry toast and tea, majority of that vitamin D supplement will not be absorbed. You need a little bit of fat in your meal to help it work, even if it's a spoon of full fat yogurt or a few almonds or some eggs, which can easily do the trick. One study found that absorption was up to 32% higher when vitamin D was taken with a fat containing meal. Number 2, don't ignore magnesium. Your body needs magnesium to activate vitamin D, and without it, your vitamin D stays in its inactive form, and that means no benefit, no matter how high your dose is. And low magnesium is more common than you think, especially if you have gut issues or eat lots of processed food. Magnesium-rich foods include spinach, almonds, pumpkin seeds, and dark chocolate. You can also supplement vitamin D with magnesium glycinate or citrate. Check Holland & Barrett or your local pharmacy. Expect to pay around maybe £10 to £15. Another study found that magnesium improved vitamin D status even without increasing the dose. Number 3, don't forget vitamin K2. When you take vitamin D, your body absorbs more calcium, but without vitamin K2, that calcium ends up channeling into the wrong places, such as your arteries, and you don't want it building within your arteries. Vitamin K2 helps guide calcium into your bones and teeth, and that keeps it out of your blood vessels. You'll find vitamin K2 in foods like, you'll find it in aged cheese, liver, and egg yolks. But if you're taking vitamin D on a regular basis, especially at high doses, then consider a vitamin D3 plus K2 supplement. Look for one with the MK7 form of K2, and that's the type with the best bioavailability. Aim for 90 to 100 micrograms a day. A clinical trial found that vitamin K2 reduced arterial stiffness and improved bone markers. The NHS recommends 10 micrograms a day. That's 400 international units. But that's just the minimum to prevent deficiency, not necessarily what's optimal for you. Many adults need 1,000 to 2,000 international units daily to stay in the healthy range, especially if you have darker skin, wear covered clothing, or spend most of your time indoors. But don't guess your dose, get tested. If your levels are low, your GP might prescribe a loading dose, usually 20,000 international units weekly for a short period, but that's always done under medical supervision. Too much vitamin D can cause toxicity, and that's why you always need to speak to your doctor before trialing anything new. With toxicity, symptoms include nausea, kidney strain, and calcium buildup. So never mega dose without a doctor's advice. Number 5, don't just take it in winter. Most people stop their vitamin D the moment summer hits, but that only works if you're getting full body sunlight every day without sunscreen and you're uncovered. If you've been deficient for years, a few weeks of sun will not fix it, and sunscreen, clothing, or staying indoors blocks vitamin D production. That's why I often say be consistent. Think of it like brushing your teeth. Don't just do it seasonally, you stay consistent all year round. The main question I get asked is, how do you know if you should see a doctor? You can always see a doctor if you've got bone pain, muscle weakness, depression, or you just keep falling ill. Ask your GP to get your vitamin D checked, and also if they can check your calcium and parathyroid hormone levels as well, especially if you're taking high doses long term. And if you've got a digestive condition, liver issues, or kidney disease, you'll definitely need a personalized approach. So always speak to your GP. So let's recap the 5 things you need to get right. So take your vitamin D with fat. Number 2, make sure you're taking it with magnesium. Don't forget vitamin K2. Number 4, get the right dose for your body. Number 5, don't stop because it's sunny outside. And always test before you take high doses, because when you get it right, you don't just avoid deficiency. You can start to feel better, stronger bones, better mood, stronger immune system, and all from one very cheap small capsule if done properly. If the video helped, please give it a like, hit subscribe, and drop a comment below. Thank you for watching, and see you in the next one, inshallah. Take care. Assalamu alaikum.